Greetings, PsychU community. Dr. Rachel Self here with Otsuka Neuroscience Medical Affairs. Today, I am joined by Dr. Mojgan Maki, who is child, adult, and adolescent psychiatrist in the Chicagoland area. She's also faculty at various academic centers, both locally and nationally, as well as serving as a board member for the Illinois chapter of the American Academy of Child and Adolescent Psychiatry, or ACAP. Thank you so much, Dr. Maki, for spending some time with us today as we continue to celebrate Mental Health Awareness Month with our series covering mental wellness across the lifespan.
Thank you, Rachel. It's great to be here.
So today we're really excited to have a little dialogue with you around one of our various infographics that we have put together for our PsychU community to discuss different aspects of mental wellness across the lifespan. So with your expertise in child and adolescent psychiatry, we thought it would be great to hear from you on this infographic covering mental health in children, looking at some statistics as well as some of the resources offered by our supporting organizations. So as our audience orients itself to the infographic, which will be available for download through our PsychU website, we'd just like to start with the top portion of the infographic that's really going through a lot of the most current statistics that are available through various organizations, including the Centers for Disease Control, the World Health Organization, as well as some of our supporting organizations, such as NAMI. So I know that you had a conversation really setting the foundation for child and adolescent psychiatry and some of the key diagnostic areas, as well as some of the key challenges and some guidance for parents, caregivers, and other healthcare providers, where a lot of these statistics were discussed. But if you could orient us a little bit more, maybe to some of the things that are new and featured on this infographic, we would really appreciate hearing from you.
Sounds good. Thank you. It's great to be here. And as a child adolescent psychiatrist, it's wonderful to have the opportunity to work with families and children and to provide the support that they need through some of the challenging and difficult times and diagnoses. I think we reviewed a lot about the fact that mental health disorders exist in children. And we know that many of the psychiatric disorders, many of the times that we see mental disorders in adults, about 50% of the times they start at age before 14, and about 70% of the times they start before 25. And of course, those statistics can be different a little bit depending on the area and the race and ethnicities. But it brings the fact that mental health disorders exist in children, and we have to be attentive to it. Some of the statistics and the rates that we discussed talked about anxiety disorders as one of the more common disorders with 7 to 10%, depressive disorders about 3%, and we reviewed behavior problems such as oppositional defiant disorders, impulse control disorders that are in the 7% range, as well as the ADHD that is about 10%. And when we compare these rates to adults, we actually see that most of these disorders are chronic and they may wax and wane through life, but it's more likely that the child or the youth will continue to present with some or all symptomatology as they get older. I think we also talked about some of the challenges that we have in regard to not really having enough workforce and talking about how there is shortage of mental health providers and clinicians for child adolescent psychiatry. And that is an area that we can all think of how we can provide additional support to the community. I want to talk a little bit about the mortality and morbidity rates, and that the psychiatric and behavior problems, including suicide, homicide, and accidents, are the leading causes of youth and young adults mortality in the general population. and they are frequently involving with substance use disorders. Globally, 1/4 of mental health substance use disorders occurs and starts as a child or as a pre-adolescent or as a youth. Those are really big numbers, and suicide is a real concern and something that we really need to address. In some areas, it is the second leading cause. In some areas, it's the third leading cause. But it is so important for us as clinicians and for our families, educators, to be comfortable, to be knowledgeable, to become knowledgeable about suicide, and to be comfortable to have the conversation and the discussion of suicide. Another areas that I want to talk that we didn't talk much about was the LGBTQ group. And although the majority of LGBTQ youth are healthy, in comparison to the general population, they are at increased risk for mental health problems, including suicidality, as well as increased risk for depression, anxiety, substance use, and eating disorders, tobacco use, and even HIV and AIDS. And these are significant morbidities and causes of increased mortalities. Going back to the community, we know that there is a mental health disparity for the LGBTQ population, including the biases in laws, policies, and society norm. And I always in conversation with finding ways that we can have comprehensive public health efforts to reduce this mental health disparity amongst the LGBT youth and to address the stigma that is still associated with this group. So these are some of the highlights of the basic rates and conversations that I think we had last week. And I think we want to talk a little bit about the support systems and some educational and support communities that are available to us locally and nationally.
Absolutely. And as we get into that, I'm going to do a few shameless plugs here really quickly. I do want to invite our PsychU community. If you haven't checked it out already, please do check out our interview on mental wellness across the lifespan with Dr. Maki that really provided a wonderful deep dive where she had a dialogue with our colleague, Dr. Jacqueline Canning, about some of these statistics, those challenges. So check that out, as well as many of the other interviews that are part of this series that we have done where we've provided deeper dives with the supporting organizations shown on this particular infographic. So that's my shameless plug. And I'll do one more for you as we know we're going to take a deeper dive later in the year as well with you and one of our experts in suicidology, where we'll talk about that much more. So stay tuned for that, everybody. But this is a great time for us to transition and really talk about, from the clinician perspective, from your perspective, some of these resources that are targeting children, teens, and young adults, what you've utilized, what you find most helpful, how you would envision other healthcare providers or even parents and caregivers utilizing some of these resources. So we can go in the order in which they're shown if you'd like. I will point out to everyone, this is not alphabetical, as those astute viewers have probably already noticed. What we decided to do for listing the supporting organizations was to go by the year of their origination. So Mental Health America is actually our oldest advocacy group for mental health that started in the United States in 1909, if you can believe it. And they actually were instrumental in helping to develop the national recognition of May Mental Health Awareness Month. So that's why they're listed first. We can start there if you'd like, and then just kind of walk through all the different resources that you have utilized and how you would envision other healthcare providers utilizing. The final thing I'm going to say before I kick it over to you is that what you'll notice, PsychU community, is that if you do download these or you access these on the infographic on the website, the logos, you can click on the logos and that will take you directly to the supporting organizations website section that covers the youth-focused resources. So trying to make it as easy as possible for you to access these resources. So, all right, Back to you,
Oh,
Moshka.
that's good. So I think Mental Health America, the founder was actually going through and suffering from mental illnesses and faced, struggles with education, awareness, and stigma related to it. And I think it's just an amazing story and so wonderful to have these organizations. Oftentimes when I'm doing my psych evals for kids, parents are surprised to hear that a child can have anxiety disorders or the child can have behavior disorders. And we often see there is a delay, a 2-3 year delay before the family brings the child in to mental health clinician for an evaluation. Because we want to think that, oh, maybe it's a phase, maybe it's just the school that's difficult. And I think it's really important to use the resources to understand what it is to have, how mental health disorders are presented in children, and to just have the ideas. I'm definitely discouraging families to think of diagnosing their children or to become, providing therapy for them, but more for an understanding of what mental health disorders might look in a child and at what point we want to consider asking for additional help. So some of these resources, like Mental Health America, has a really great site on their website that you can look at some of the screening tools for depression, anxiety, bipolar, and it's quite expansive. I think that's a great resource for families to use if at any time they think maybe there is something. But again, to use that and whether the test will flag something or don't, still keep an eye, have conversations with their pediatricians, have conversations with families and their support system to keep an eye on the concerning behaviors that they see in their children. The Depression Bipolar Support Alliance, I adore their mood crew, and I know we've talked about it, and it's just, they're so cute, and they have these conversations with each other. The other day I was looking at the one that was like talking about confidence versus doubting yourself, and it related so much to me when I'm talking to my patients about social anxiety. So I think that's a really nice platform for families to tap in and to find ways that they can have conversations about identifying and understanding of feelings, and to identify and understand that, even to make themselves an example, that mommy is feeling upset today because of this and that type of a situation, and kind of bringing that, opening the conversation so that children can understand, identify the feelings, and to normalize that it's okay to feel sad, it's okay to feel anger, and these are all some of the feelings that we feel. It's more about learning how to have a conversation about it rather than acting on it. NAMI, of course, is perhaps one of the largest organizations. I think in my area, we have somewhere around 10 to 12 local chapters of NAMI. And again, a great community for education, as well as providing group support for folks struggling with anxiety disorders, mental disorders, and also for the parents and families of individuals with mental health disorders. And lastly, we have the Psych Hub, which is a great platform for videos and audio recordings, very specific to specific disorders. They have a very nice platform with substance use And I've seen a lot of nice platforms for eating disorders in that group. And then, of course, we have other organizations such as, American Academy of Child Adolescent Psychiatry that has a great website with an area for facts for families that really talks about some of the flags and warning signs for children with mental health disorders, some recommendations and suggestions about how to talk to the families, again, some facts about, the common misunderstandings in LGBT groups and gay and homosexual parents. So all of those are really great resources. Once we have all those resources, I think the key is if there is a concern, please talk to the pediatrician, talk to your clinicians. And at times it's more something about let's monitor and see how things evolve, but it's just important to have that conversation with a mental health provider or with schools. Schools are always great resources for our kids and for families.
Yeah, these are great tips. Thank you so much for sharing at least some of the resources that you're familiar with that you've utilized in your practice. We do appreciate hearing that. And I know, you and I have had conversations over the years about some of these resources. And one of the things that particularly has been surprising a little bit to me, DBSA, their national headquarters is located here in Chicago. You were mentioning, what a large presence that NAMI has in Chicagoland. And most people probably have heard of NAMI and they're aware that they can go to that particular organization and get support and access some of those groups. But a lot of people aren't aware, a lot of healthcare providers, even when it's in their own backyard, aware of some of the places that they can go to get support and to access some of these resources. So I echo what you're saying, reach out to others, maybe to other colleagues. And one of the other things that we can recommend, we have a large field medical team, medical science liaisons, such as myself, all across the nation. So you can always go to PsychU and look at the About section where you can meet our field medical team. If you don't already know who your medical science liaison is, reach out to them. They are aware of all of the resources that you probably have at your disposal within your state, within your town, within your backyard. So I did want to go ahead and encourage people to do that. And I just wanted to provide you with the opportunity to talk, if you would, a little bit more about some of the practical applications. Obviously, you were mentioning the Mood Crew, but if you have any other insights for our PsychU community of healthcare providers and those that touch behavioral health, some of the practical applications that you would suggest with these resources in addition to what you've shared.
Yeah, it's a challenge for children to understand, identify, and to verbalize their moods and their feelings. And at times it can become frustrating for families or even for clinicians because that's really the principal element that we need to know, how the child feels or what are some of the barriers and the struggling factors. And cognitively, it can be a challenge for a child to express those. And furthermore, if there is a language or an expressive language disorder or a diagnosis of pervasive developmental disorders, it really becomes a challenge for the child to understand, to process, and to verbalize and put it in words about how they feel or how they perceive their environment. So a lot of the work in child psychiatry is around using tools to provide that, to create that dialogue with our children and with our families. And if we have the dialogue, then we are able to use the dialogue to support the child and support the youth in their journey of treatment. Using Mood Crew and illustratives such as Mood Crew is a tool so that we can use in our primary work with children to build that common dialogue of understanding what it is when we are angry, how our mind feels, how our body feels and how to understand those cues so that moving forward in treatment, we can use those cues to give us the warning signs that, oh, this is when my therapist or my doctor told me that I need to use the deep breathing technique. I now remember the face of the angry mood crew, and I remember that it associated me with my heart pounding really fast. And then I remember my doctor told me, when you feel like that, put yourself in a calm environment and take some deep breaths. I summarized it in a minute, but it takes a long time to create that environment. But it's wonderful to have these tools so that we can use. And then I also would extend that then parents can use that at home and use it so that they can have that dialogue. And if they see their child sad or embarrassed, they would be able to process that information with the child. And I also like that there is also some healthy ones in there, because we want to balance the conversation we have about the disorders and the challenging feelings and behaviors we have with some of the more effective ones, such as confidence, happiness. So we don't want to only focus on the, let's say, negative ones, although I don't really like to use the word negative because they're not negative. Anger is a part of life. Feeling anxious is part of life. But I like that we kind of balance and have some of the more positive ones and some of the ones that are a barrier and can become difficult to manage.
Yeah, you make some really fantastic points, and we're hearing more and more some recent congresses that we've been attending, and just as we continue to learn more in science and research about trying to maintain that balance or create that balance in life, right? You don't want to always focus so much on some of the negatives. Obviously, the statistics are becoming alarming, but we also need to keep in mind that there's a lot of these protective factors that can really go a long way, even if there are problems, to helping us not succumb to some of the issues that anybody might be experiencing, particularly during these times. So I think that's really important to keep in mind. It's all about trying to strike that balance, right?
Yeah, I think, we talked a little bit about it before, that like when it comes to food and eating, we don't want to call it bad food or good food. Similarly with behaviors, we don't want to call a behavior necessarily a bad behavior, but we call it not such an effective behavior.
Yeah, that's fantastic advice, I think, for everybody to keep in mind. We're all humans. We're going to have a range of emotions, a range of different experiences, and it's all about trying to beef up those protective factors. And that's why we're so happy that we've had you and a lot of our other individuals that we've been able to feature during our May mental wellness celebration month. So thank you so much for your time.
Oh, thank you.
And it's been fantastic, yeah, and we look forward to continuing the dialogue in the future throughout the rest of the year and the years to come with you. So thank you.
Thank you, Rachel.
So with that, we are going to sign off. I do want to go ahead and remind everyone, we mentioned a little bit about some of the suicide-related statistics in our young adults and youth today. So I did want to just go ahead and let everybody know that if you are someone that you know is in crisis, you are not alone. If there are issues with suicidal ideation or suicidal behavior, please contact the Suicide Prevention Hotline at 1-800-273-TALK. That's 1-800-273-8255. Or there's also a crisis text line that you can text 741-741. There are people out there to help you. You do not have to experience this alone. And we look forward next year to being able to have the 988 number. So look forward to that coming. Again, Dr. Maki, thank you so much for your time, your perspectives, and your insights. And we look forward to the next chat. Thanks to the PsychU community. Please download the infographic and utilize this and access some of the supporting organization resources that you have at your disposal. And with that, stay well, everyone. We look forward to our next chat.
Sounds good. Be well.